I am excited to begin our Make America Healthy Again Task Force meeting number 1. And in fact, myself and co-chair Lockett have put our heads together. But I will acknowledge that the desire for today's meeting was to place a little bit more framework around what we hope to accomplish during the legislative interim. So this may feel a little different than the kickoff of other task forces that perhaps we've participated in. Today, we're going to utilize our time together to build out priorities. I want to hear, our hopes are to hear from other members on our task force what your priorities are, but also if there are people here today that would like to acknowledge what they would wish for our priorities to be, please sign up, and we'll grab that sign up sheet in about 10 minutes so that we can give you an opportunity to speak. Our intent is not to go longer than 90 minutes this morning because we have an A&R committee meeting at 1 o'clock. So, and we're all going to eat our fingers because we're making America healthy again. So we won't break for lunch. But ultimately, the hope for today is to really listen and gather in what the priorities are. And then after we take roll call here in just a moment, then we will encourage just a quick review of what came out of Washington, D.C.'s Make America Healthy Again priorities, and then come back to what will we drive towards in our Kentucky task force efforts. So if you would, who will be calling the roll?
Me.
Okay, Mr. Secretary, please call the roll.
Senator Chambers Armstrong. Senator Douglas.
Present.
Senator Richardson. Senator Wheeler.
Here.
Representative Callaway.
Present.
Representative Duvall.
Present.
Representative Moore.
Here.
Representative Proctor. Co-chair Lockett.
Present.
Co-chair Funky Frohmeyer.
Present. Thank you. And I don't believe that we necessarily need a quorum to conduct business, but we will take a moment now. I would like to hand things over to my co-chair, and then we will move on to kind of purpose and goals.
Yeah, fantastic. And I just want to say a few words. First of all, we appreciate all of you being here today. Just in terms of the crowd that's here, we appreciate the interest. I'm sure all of you are kind of curious as to where things and our discussion will lead. And a lot of this is born out of really when we look at health outcomes in our Commonwealth and in Kentucky, we see that we lag behind a lot of the other states in the nation. And so we want to look for, come up with, discover, recommend a lot of different ideas that could possibly be in the form of legislation, ideas that could, change the landscape in terms of our Commonwealth, in terms of how we administer different benefits, those types of things. And so our conversations have started already with different industries in the Commonwealth, whether it's beverage industries, whether it's C-stores, whether it's insurance companies, so forth and so on. We've begun those conversations to really make this a collective effort to not say, here's what we're going to do, you're just going to have to live with it, but we really do want input, and that's the purpose of today and all the other task force meetings as well that we hold is that we want input from all of our members, input to say, how can we do this as a collective effort to make our Commonwealth healthy? And we have decided that for each task force meeting that we will not be handing out Krispy Kreme donuts. So we made that decision kind of on our own. So so I think we are going to jump into the overview. So I will turn it back over to my co-chair.
Wonderful. And I very much like your overview. co-chair. I think that this looking for the root cause of the illness kind of bore our concern and interest on Make America Healthy and getting to prevention. And I'm very excited that we have Dr. Douglas on the committee as well, but of course that we also have my fellow senator from Pikeville, because we've recognized that there's such a need to amplify our economic health in the state with more people working. After a legislative session, last task force, last interim, was we don't have enough Kentuckians working that are between the age of 16 and 65. Why not? And if we can take some of our task force time into getting into prevention so that more people are healthy and well, mentally, emotionally, physically, and that's great for Kentucky. And that's part of the health that we're looking for in Kentucky.
Madam Chair, if I could have a brief moment of personal privilege. I see my Pike County Health Department Director, Tammy Riley, back there, and I know she's very interested in the topics that we're going to be discussing over the interim and came down to this task force. So I'm very pleased to see her here today, and I would ask that she made to be feel welcome. Thank you.
Thank you for being here. And on that note, Senator Wheeler, I would like to go to each task force member and acknowledge if you do have someone here, but also acknowledge what might be your purpose or goal for the task force or your hope. And then next we'll go into the commission report.
Well, I obviously think that it's important to tackle some of the obvious causes or problems we have of childhood obesity, adulthood obesity. Obviously, I could stand to lose a few pounds myself. Maybe that's due to the food. I don't know. But maybe work on some of the benefits programs to make sure that the healthiest and most sustainable nutrition is delivered to our folks. Clearly, we want to protect those in need, but do so in such a way that encourages model behaviors and a healthy mental and physical upbringing. So I look forward to looking at those things.
Great. I heard sustainable nutrition. I heard encourage model behaviors. Great. Thank you.
Thank you, Madam Co-Chair. I'd actually like to recognize Jennifer Fraker for being here. She's here with the university, representing the University of Kentucky. And our tertiary care centers are vital, absolutely vital, in spreading the word across the Commonwealth of not only what should be done, but what we need in participation from our patients. What I'm really looking forward to introducing is the concept of health responsibility. Who really is responsible for our health? And we often look at the healthcare system to have them be responsible for our health. And the truth is, we are personally responsible for our health, and I want to bring that to this committee. Thank you.
Thank you, Senator Douglas. And in fact, I also want to recognize a guest. I see Jenny Sand here from Northern Kentucky University, and then I also see our friends from the hospital system here as well, and so many other friends in the room that do very much care and are living in the acute care setting. Jim, in knowing that if we didn't have a great acute care setting, we'd really be up a creek, but we do have a great acute care setting. We are trying to get ahead of that, get people not entering into the hospital system for preventable illnesses and proactive prevention. So my objective is that we've got what I'm going to say are 10 very engaged legislators on our task force. And my hope is that we may, in fact, come away at the end of this week, and myself and Representative Lockett will hear from each of you to say, you know, I'd like to really dig in deeper with our Kentucky Department of Education because I've got a special heart or an interest there. Or I'd like to dig in deeper to our Kentuckians with disabilities that may benefit from something different. Or I'd like to dig in deeper to agriculture. What is agriculture? So keep that in mind as we're talking today. Perhaps you've got a cabinet or an agency that you've got a special interest or a special heart to dig in deeper. Mothers, Representative Mosier, when I see you sitting in here, but just knowing that perhaps we want to come out of this with actionable items, but we want each task force to present to us what difference it would make. So bringing experts to the table to help guide us on this policy adjustments that we will be making some changes. I feel wholehearted about that. Okay, Rep. Lockett.
Thank you. I just want to kind of piggyback off of that as well, and to say really, my goal in this task force, in our work that we'll do over this interim, is to really ask a lot of questions. We know that a lot of the things that we deal with in the Commonwealth has to do with health, whether it's mental health, whether it's physical health. A lot of issues that we deal with in our schools have to do with mental health, with our younger population. And so this deals with all of that and how all of that flows together and how can we get our arms around some of these issues that we deal with. I do want to recognize, and I'm actually going to have them introduce themselves because they are important to this conversation as well. Some of our colleagues are sitting over here, and so I'm going to ask them if they would introduce themselves. They are not actually on the task force, but they carry vital voices as well. So Senator Tishner, I'll ask you to go ahead and start.
Thank you so much. I'm so excited about this task force. When Senator Funky Frohmeyer mentioned that what MAHA means to the Kentucky Department of Education, that really sparks an interest in me. Like, how can we make sure our students are focusing well? Are we feeding them well? Do they have healthy food when they go for their lunches? Are they outside? Are they getting enough activity and really getting enough vitamin D, being outside in the sun and breathing fresh air? So that's an area I hope we'll hear a little bit about as this task force moves forward. Thanks for letting me sit in.
Chair Mosier.
Thank you. It's a pleasure to be here. I am very excited to dig in more deeply to some of the areas of concern. And, we all care about, or we should care about, nutrition and health and its impact on our Kentucky citizens. Not only that, but activity in schools is something that I've worked on in the past, and we've had good conversations about it. I'm just looking forward to these discussions and any recommendations that come out. Hopefully we can partner with our health services committees and help really work on substantive legislation if that's what is determined to be needed. It's not always needed. And I would also like to encourage working with the Kentucky Academy of Science. These are some really great partners that we don't utilize enough here in Kentucky. And there are a lot of issues that we could talk about with in the science realm, but one that I'm concerned about is the science proficiency rate among our Kentucky students. It's in the single digits. I want to know why that is. And I think that as we continue to work on our healthcare workforce, for example, we need to pay attention to this low number. I don't think that it's necessarily a surprise that we have a shortage of healthcare workers if we're not exposing our kids to science. So I'm happy to make any connections that will be helpful, and look forward to the partnership.
Fantastic. Chair Meredith.
Thank you, and appreciate the opportunity to be here as well, and plan to make as many of these meetings as possible. You already made reference that we have such poor health outcomes in Kentucky, and internationally our health scores are terrible. And what I find ironic about that is the work that will be done here will touch every committee that we have in the legislature. And we forget that we don't live and work in a vacuum. and everybody's going to be impacted by this. I've been preaching for the last year about the unsustainable growth in healthcare costs, particularly in the United States. If we don't get control of this, I truly believe it's going to cause our economy to collapse. And it's measures like this will help move us forward. It's not the total solution, but it's part of the puzzle that we have to work on to really address this. And I hope we're all committed to this mission to improve the health of our population. And obviously what you will do here will have impact on what Co-Chair Mosier and I do in health services. So we have a very deep interest in this. Appreciate the opportunity to be here. Thank you.
Thank you. I know one of the things, just kind of as a piggyback off of that, and I think we got everybody, I believe, is that to look at among the host of things that we will look at. One of the issues that former Commissioner of Agriculture Ryan Quarles began to work on are the many food deserts that we have in the state. And when you talk about when you're from an area like I am, from Lexington and Nicholasville and Jessamine County, it's not an issue that you really think about. But when you're from Eastern Kentucky or different areas and you say, well, you've got to purchase this, this, and this, and well, to get that, and that, you have to drive 30 minutes down the road possibly to even get to a grocery store. And so there's a lot of these types of areas in the state that, one of the issues that I believe we'll be taking a look at is how can we encourage or how can we begin to remedy that issue as well.
Yeah. Representative Callaway.
Thanks. So I appreciate having this opportunity to have these discussions. One of the things that's been brought to my attention, and I'm in the Louisville area, but I do have some rural areas and a little bit of Bullitt County, and I would like to discuss agricultural topics. I think it would be important to go to, okay, the pun is intended, but to the root of the problem, or the root where it starts. And, I appreciate what Senator Meredith said. I think these discussions need to be had because, we do have a bloated healthcare system. And again, I think we just need to start with agriculture. So I want to hear from I'm drawing a blank, our agricultural Shell, right, because I was going to say Quarles. So Jonathan Shell, I would like to hear a little bit from him, see how we can combine and support our farmers, make sure our money is staying here with our local farms as much as possible, encourage that. And then I would also echo what Senator Titchener said about being in the school system, help our kids to make better choices in their food choices from the start and empower the parents to be able to do that. Whether that is making the food more affordable or, as Co-Chair Lockett said, the availability of it. So I'm really excited about this. I think it's a very broad topic, as we've obviously discovered. So as much as we can stay honed in on a few areas, I think that would benefit us, and just keep in mind that it doesn't all have to be solved right now. I think if we can choose some really pertinent directions to take and like I said, hone in on those and not kind of chase every rabbit, I think that would be ideal. So again, I appreciate this opportunity. I'm really excited about it. And I do appreciate everybody who's here today showing interest in this. Thank you.
Thank you so much for having me here. And I echo what Representative Callaway said as far as the interest that's in this room. My interest on this committee, I do want to keep it pretty simple as well. That intersection between what our healthcare providers can provide, kind of where the boots on the ground meet our health. What can we do as legislators to allow our providers to do the work that they are trained and qualified to do? So our hospitals and doctors. I also agree very much with what Senator Douglas said, and health is very much our personal responsibility and what we make of it. But how can we help our providers, our hospitals, and our doctors to provide health? My wife always makes the comment that we really aren't a healthcare society, we are a sick care society. And that's just because that's how it's incentivized. I'm not sure we can get around that much because of how ingrained we are in the system of the way insurance works and the way providers are paid. We don't incentivize proactive healthcare anymore. But I do think we have doctors and hospitals that want that, insurance companies that want that. And I think we can stand as a testament across the country of how we as a legislature can allow that to happen, at least make the right steps forward to that.
Senator Richardson, I love your words. In fact, the providers, I would love to talk with you further offline to dig in deeper onto whom we might invite, because one thing that came out of this proactive symposium with Dr. Bale and Doneen about the Bale-Doneen method was many of our doctors do not go through medical school with the nutrition training and some of what we were just talking about, healthy nutrition in schools. But imagine all of the visits that you might make to a primary care physician or a pediatrician, and talk a little bit about nutrition. But is there any sort of a regular cadence in training the families and the children how to read labels, the family and the children on what's the difference of a healthy fat and what's the difference of a protein and a carb and all those things? So some of that I would like to get a better understanding of what is ongoing continuing education for nurse practitioners, for doctors, for dentists, for all of the providers. And if you're able to maybe make that a specialty part of your role to this task force, would love to dig in deeper. And candidly, Representative Callaway, I like your point. We could chase a lot of rabbits. And Rep. Lockett and I talked about being very food. But of course, food in school, food on a farmer that might be a 7-acre farm, not a 700-acre farm. Like what are we doing to support what we care most about? But food, and it could be SNAP benefits, as Representative Lockett filed last session. Food. So perhaps we're going to be more food driven, but as that relates to training providers. And so I digress as we continue to meet our task force. And Representative Adam Moore, it's nice to meet you. I haven't had a chance to visit with you yet.
You as well, Madam Chair. Thank you for that. First, it's just so nice to actually hear from the individual members who are here today and hear that we care and we're coming from our own place of individual experiences, our place of our individual expertise that some of us have. And we care about Kentuckians, and we're not getting into political points. And I love that now here my first day on this task force. Senator Meredith made a great point as far as the rising cost of health care and it being unsustainable. And it's both cost to us as the government, but also cost on the individual. They're both rising too steeply that we have to bear. And I like that our Madam Chairwoman said the word prevention multiple times now. It costs less money to prevent disease than to treat disease. It costs less money to prevent sickness than it does to treat sickness. So how can we go about doing those things? As a fitness coach on this panel, I'd be remiss if I didn't talk about the role of physical fitness in that. Now, one thing I do love about physical fitness is it is a hedge against poor mental health. We've seen that in research over and over again. But also serves as a hedge against chronic disease, especially those tied to obesity and heart disease and diabetes. And those all place an undue burden on our healthcare system, an undue burden as far as costs, but also an undue burden as far as just limited resources and capacity, like Senator Richardson was saying, for providing care. It costs more money as we're treating all these people with chronic disease or in chronic sickness, but at the same time, it takes me longer to get into a potentially necessary appointment that I need or my wife needs or my child needs when there is more and more demand on the system. So I'm all about finding those methods, those avenues of prevention. I want to explore that from the physical activity side, given my own role outside of these chambers as a fitness coach. But also really love that Representative Callaway said, working with Commissioner Schell, the phrase food is medicine is used from time to time, but I don't think it's used enough. And whether that is in our schools, in our grocery stores, in our homes, in our senior living facilities, how can we use food as medicine to prevent this disease, to prevent chronic conditions? and really excited to dive into those and make real progress on those areas. So thank you.
Thank you so much, Representative Moore. I did not know that about you, so now you're in. We are going to look to you to be the expert. And on the food as medicine, I do see our capable leaders from the Kentucky Hospital Association in a conversation yesterday with Commissioner Schell. He's very excited to share kind of what results they've had thus far in their food as medicine. And unfortunately, twice in the last 2 years, I've spent about 8 to 10 days giving lots of love and attention to my mom and dad, who are now 85 years old, but just absolutely shocked at the food that they were offered while in the acute care setting. And I think the hospitals really care to make some adjustments, but we'll be perhaps waiting to hear back, like at what point would you like to testify as to maybe some of the direction that the hospitals are taking without us forcing certain legislation down anyone's throat. I don't think anyone wants to do that. I don't think we want to fatten our KRS code. I think we do want to improve dramatically that perhaps there's too many regulations, and we got to scale some of that back so that we're not too broadly offering foods that are just really garbage, and even narrowing what's available in schools and hospitals and such. So thank you. That's great direction. Representative Proctor, so glad that you're on the committee.
Thank you. I'm really excited to be on this committee, so thank you for that opportunity. I agree with Senator Richardson that we do too much sick care. We don't do well care. It's too easy to go in and you've got your 6-minute appointment with your physician and then you're moved on, and there's not an in-depth analysis of what's going on, what really is the problem and what's causing it. It's really easy to prescribe medication for long-term diseases, and so many of them are preventable. We have so much data that is saying it's our food, and we know that our food is not great, and I'm glad to see at the federal level that there's going to be some significant changes on there. I agree with you. Exercise is really important. We've become much more sedentary, but looking at all these other issues that we're having, I'm very concerned as the rises of autism that we've seen over the last several decades, that the auditory processing disorders, ADHD, why have we seen those go up so much? And I'm hoping that we can kind of look at that, what is happening, and to do more to instead of just doing a Band-Aid for what is plaguing somebody, how can we fix it? And maybe look outside the traditional medical scope, from the way that we treat cancers to the way that we treat chronic disease. So that's not just one particular program that works. I'd love to see that we have more access to locally grown meats, eggs, dairy. I would like to see those. We've got farmers, we've got that here in Kentucky, and we know that local and fresh is going to be better than something coming from packaged. So I'm hoping those are areas we can really focus on and make some significant change to improve the health of Kentuckians. Thank you.
And Representative Dr. Duvall.
Oh, it's great to be serving on this task force. So thank you, Madam Chair. One of the statistics when I started in the legislature that I saw was that Kentucky ranks near the bottom in terms of health outcomes in our country, and that has really got my attention. And I think better outcomes usually are going to come when we have better education, and so I think educating our public about the needs for preventative health care, the needs for better nutrition and exercise, those kind of things. So I'd really like to focus on the education aspects of that, because we know that these habits start at a young age. And so we need to make sure that in our schools that we do have healthy food choices and options, because if they don't start at a young age, then those problems are going to continue throughout the lifetime. And the nutrition also affects sleep. We haven't really talked much about that, but sleep, poor sleep habits result in poor mental health as well as physical health issues. So we need to be thinking about that and how that sleep and nutrition tie into one another. Other aspects, my concern, being in eye care for 30 years, is the epidemic of diabetes. And that's one of the leading causes of blindness in our country. We need to wrap our minds around diabetes and why we've got an epidemic and what we can do to help slow that down as well. Other quick notes: I think we've got to do better in Kentucky of having better access to dental care. A whole lot of reasons for that, but as I was talking to a local physician about these issues, he was sharing with me that our cancer rates in among 20 and 30-year-olds is going up. He was sharing with me that he sees a lot of kids that are on both stimulants and antidepressants, and how that nutrition ties into that, and how that can be an issue. So anyway, there's a lot of issues, but I think it goes back to education and nutrition.
Thank you so very much. I think it's really good to hear from all of our task force members, just kind of in their individual goals, what they hope to see. And I want to encourage you, whether you're in the audience or whether you're watching on KET, I want to encourage you, if there's an area of this task force maybe that you heard appear from a member, or maybe that you are interested in an idea, I'm going to encourage you to reach out to myself, to my co-chair, because we want to hear from you. We want to hear your ideas. We don't for a second think that we have all the answers sitting up here, because we don't. That's the whole reason for the task force. So we want to hear from you, and it's important that we not only hear your opinions, but if you are in a particular industry, or if you are connected to, or you represent a particular industry as well, we want to hear from you how some of these might impact you, how some of these suggestions might impact the people that you represent, and so that's important to us as well. And I'll say this before we jump into the commission report. I want to point out to everyone that each member on this task force was chosen for a particular reason. Whether it's background, whether it is interest, whether it's we believe that they had or could bring something to the table. So it's not by accident the people that are sitting up here. But I think I would speak for all of us to say is that we come into this with open ears, and we come into it saying this is health of Kentuckians is not a partisan issue. It is not an issue where we're going to say, well, this is the Republican way to do it. It's health. And so we want to come with solutions to say we want our overall population to be healthier, and what is the government's role, if any, in doing that, in making those suggestions. I will tell you, as part of my personal journey, partly because of the task force, partly because I looked in the mirror after session, I am on a personal journey myself. I've lost 10 pounds since session was over. I've got more to go, but it's that personal choice that we've talked about. Apparently that comes off. That we've talked about in that ultimately for us to be healthier, we have to have the tools and we have to have the will. And so that's what we hope to give is the tools. We can't provide the will, but hopefully we can provide incentive and the tools to do that. So with that, we're going to jump into the commission report, and I will hand it back over to you.
Great. So you'll see on the large screen, but also I believe everyone has a copy in their packet for a takeaway. The MAHA Commission report does focus on effectively 6 key areas. One being that chronic disease crisis, a generation at risk. The second being ultra processed foods. The third, the cumulative load of chemicals. The fourth, the digital age and physical decline, as Rep. Proctor alluded to. Number 5, over-medicalization of children. Number 6, the scientific integrity and corporate influence. So certainly each one of these particular areas does acknowledge that there's opportunity for state legislators to consider. This did come from Secretary Kennedy's team out of D.C., and we do have a very good regular communication. In fact, last week, Representative Hart filed a bill around that we actually need to remove fluoride from water rather than ingesting it. There's other ways that you might put fluoride to your teeth and provide your teeth some support. So that was a meaningful, about a 40-minute conversation with Kennedy's team in providing us some additional support documents of other testimony around 6 other states that have removed from the main water source. But it doesn't mean that it's removed from your dental visit. It doesn't mean it's removed from toothpaste. It doesn't mean that it's put out there as a product that is dangerous. It's just recognizing that ingesting it hasn't proven that there's other ways, and that in fact Kentucky may take that direction. So you'll hear that during the legislative interim. I don't think you'll hear that in our committee, but you will hear that during the legislative interim. As we have information pressed our direction, some of what we know, I heard from Profetti Van Mel, who's based in northern Kentucky, last week, and Profetti Van Mel asked, please keep airheads off of your list of items to ban. So I told the CEO, we don't intend to ban airheads or anything for that matter, but recognizing that we're
I'm assuming we're talking about the candy and not people. Correct. Just making sure.
Yeah, in fact, by the way, I'm a little bit addicted to bubble gum or to gum, and Airheads now makes gum, which I didn't know that. She gave me a pack to chew on, and it is sugar-free, Airheads gum. But ask that if what happened in West Virginia, recognizing that there are food dyes being added to so many foods. So West Virginia did legislate to ban that, but Profetti Van Mel is now in a challenging position to reformulate certain foods when they in fact took a proactive position to remove certain dyes years ago, kind of low profile. People weren't necessarily aware of it, but perhaps those are people that we'll want to hear from during our task force, because we also think we can signal to other food manufacturers, be proactive, so that nationally you can continue producing food that you'll sell into West Virginia and Kentucky. So just make food a bit healthier. You've got control over this. So we're again looking for those sorts of testimonies that we might hear from that would inform any change in legislation. Going on, when you look at this commission report, that number one, the chronic disease crisis, a generation at risk. This is so problematic when you look at since the 1970s, we're seeing that children over age 6, that obesity has risen 270%. So I certainly think there's something to do with the curriculum in our schools, maybe less active promotion of physical fitness that becomes a daily habit as opposed to only the jocks do that, or but that it's actually a meaningful daily habit. So this report will inform some of the structure of our next committee meetings. If there are any questions from our task force, we do have two groups signed up to speak. So I'd like to invite them to come speak, and then we'll reserve the right to ask some further questions about that. So if first the Kentucky Health Department Association, I believe Sarah Jo Best, Tammy Riley, and Debbie Miller are here to speak. And I can say that I don't know each of you so personally, but it would be great if you would introduce yourselves for the record, and then you are free to begin. And do you have a presentation as well, or you just plan to speak? Okay, that sounds great.
Would you make sure that your green light is on the microphone? There we go.
There we go. Thank you. Tammy Raleigh from Pike County, and wanted to thank Senator Wheeler for the very warm welcome. I'm here today as the president of the Kentucky Health Departments Association, and also want to acknowledge and introduce my colleague, Sarah Best, who's Lincoln Trail District Health Director and immediate past president, and Debbie Miller from Lawrence County and the vice president of the Kentucky Health Departments Association. So we thank you. We're very interested in being a resource and working with this task force. As you know, each of us are our own community's health strategist. So that's what we do as health directors. CADA, the association, represents all health departments, all 120 counties across the Commonwealth. There's 61 health departments. And at the core of our mission, I've heard you mention prevention multiple times today. At the core of our mission is promotion, protection, and prevention. So we really look forward to being a resource to this task force and helping and being involved in any way that we can. Sarah Jo?
I would just add that in 2020, with some help from the colleagues that were over here, we passed public health transformation legislation, which is used as a national standard and something that other states look to Kentucky as a leader for. And with that, we mandated that each of the local health departments complete a community health assessment no more than every 5 years. So each one of those 61 health departments across the Commonwealth of Kentucky has a community health assessment, and as a result of that, has a community health improvement plan. And so I think that those would be wonderful resources for you all as you move through this task force and your projects.
And I just want to express my gratitude for the establishment of this task force. I feel
Your mic.
On.
The green button right here.
I just want to express my gratitude for the establishment of this task force. I feel like your work will be greatly beneficial to the work that local health departments do each and every day in helping to improve lives of all Kentuckians. Thank you so much.
Thank you, and we would like to help you. And again, thank you for the work that you do. I do have a few questions, and if anyone else has questions. With your community health assessment,
yes.
How do you then deploy that? Who do you work with? What's your process?
As far as distribution, like public distribution and sharing of that information.
Yes.
The individual community health assessments, and Sarah Jo, just add anything that I miss. But the community health assessments are, it's during the process of the health assessment, the community is involved. There's individual and organizational feedback through forums, through public surveys, and from those forums and the process of the assessment, an improvement plan is established. So we call it CHAW-CHIP for short, the Community Health Assessment, Community Health Improvement Plan. Those plans are then disseminated on our websites. They're shared, via social media, but also the Kentucky Department of Public Health has a website, and CADA, the Kentucky Health Department Association, has a website. So, that's public viewing, and you can go to those websites. And during the assessment and the improvement plan process, those forums include local government entities, community hospitals, EDs, local providers from oral health to eye care to school systems, FQ, the federally qualified health centers. It's a multi-sectional type of assessment and plan that through that process, but it's widely available to our local officials, to the general public, and published on multiple public viewing websites. Did I miss anything, Sarah?
The only thing I would add is the Kentucky Department for Public Health added a public viewing part on their website where you can click on each one of the health department's jurisdictions and a copy of their community health assessment will come up. So the most recent community health assessment for each one of those health department jurisdictions is available on that website on a map.
And I would add that each county comes up with a community health improvement plan, as Tammy said, and with that, all these organizations get together and select strategic objectives. So, for example, in Lawrence County, we have 3 strategic objectives. One is mental health awareness, one is obesity and physical activity, and one is access to care and chronic diseases. So just exactly what we're talking about working here on that. And our local community is already working on those things.
And also the Kentucky Health Department Association, we're finalizing our most recent strategic plan, and it includes, outreach to local government agencies and partnering, increasing that partnership as well, and surveying the local health priorities across the Commonwealth to find commonalities. Like we know access to care, I'm from Eastern Kentucky, so an access to care, if that was addressed, there would be a domino effect, and it would solve many other problems. But we know access to care, for example, and mental health, and then just general wellness and obesity are common health priorities across the Commonwealth for all 61 health departments.
Thank you. Senator Wheeler?
Thank you, Madam Chair. And Debbie, I'm sorry I didn't see you back there initially, but I think you can see from this panel we have very strong public health in Eastern Kentucky. This question would be for any of the panelists there. Do you, I guess first in assessing the public health, I know a lot of times with the health departments, I know you're there to serve, I guess, folks at all different levels of economic strata, but to some extent, I think you generally have folks that are probably maybe a bit more in need that utilize public health services than. How do you develop an overall assessment of the community, or how do you kind of communicate with people at say different socioeconomic levels to kind of formulate a overall public health assessment in your counties?
We certainly ensure that vulnerable or high risk populations, or those with access to technology, for example. I think that's what you're addressing, Senator Wheeler. Maybe those with lower socioeconomic status without the availability of like an iPhone, for example. So we ensure that through like our federally qualified health centers, through our hospitals, our EDs, through the clinics in the local health departments, and through mobile outreach, that like surveys, for example, and feedback from vulnerable populations or populations who would not likely have access to an iPhone to scan a QR code and complete a survey. So that's at the key is really instrumental in ensuring that the whole population is represented through the community health assessment. So there's certainly focus on ensuring that all populations are addressed and are able to provide feedback. Another example is visiting senior citizen centers. So we visit senior citizen centers. We work with the directors of senior services and whatever that might look like for each county. Mobile outreach through harm reduction programs for those that are transient, homeless shelters. So there's much thought put into ensuring that all populations are included when we are conducting our health assessments. Did that address?
Well, kind of, and
Senator Joe may want to.
No, I don't know that I would. I don't know on the iPhone. I'm always amazed at people that tell me they're broke manage to have a smartphone. So I don't know about that. I don't know if I totally agree with you on that. But that being said, I guess what I'm looking at is clearly, I think public health to some degree. You hit the vulnerable populations probably the most. How do you account maybe for folks in that aren't as vulnerable economically when making an overall public health assessment, so that maybe, because I think if you just focus on the vulnerable, you might get a darker picture than what a more complex reality is. And I know that's a very difficult, thing to do.
I understand, but seriously.
It's actually easier than you think. So typically when we do a community health assessment looks at both quantitative and qualitative data. So we look at common causes for premature death, hospitalization codes, ICD-10 codes, overdose rates, arrest rates, criminal activity, graduation rates, employment rates, median household income. So we're looking at the entire picture. I think there is a huge misconception that health departments are only for those that are challenged economically. No, I know, but we struggle with that in our communities and making sure that people realize that there's public health services that benefit all of us, that we have services available to people regardless of, not all of our programs are income-based. HANDS is one of a huge, wonderful program that is not income-based. A lot of us do vaccinations that are not income-based. So anyway, I think that we struggle with making sure that people realize that we're there for everyone. Also our restaurant inspections, keeping the food safe. I just did a report yesterday where my health department in one county had removed 432 pounds of adulterated food product from public consumption, which is a direct, impact to foodborne illness prevention. And so, but when we do the qualitative and quantitative data, we do the surveys. We try to reach people in multiple venues. It might be setting up at your county fair and having people do the survey. It may be electronic. Our hospitals typically get on board with us and do that too. Actually, the people that fill out our surveys the most, that are the easiest to reach, are usually women in their 40s with at least a bachelor's degree. So it's usually a higher economic and higher educational level that'll do those surveys. We struggle to get surveys completed to represent everybody, and it's usually the lower income brackets that we struggle in obtaining that feedback from.
Thank you very much.
Yeah, thank you.
Thank you. Senator Douglas.
Thank you, Madam Co-Chair. You hit exactly where I wanted to start, and that is that in the healthcare space, we tend to lump everyone together, but the truth is we have many different populations, and accessing them and getting a response from them has a multiplicity of factors. Mm-hmm. We tend to lump everybody into one particular group. Now, as boots on the ground people, you all get to see a bunch of different populations. One of the concerns I have in the overall scope of this is we always use the term access to care, and the truth is nobody knows what that means. We can sit here and think that we do, and I think we'll address that while we are here with this task force. Access to care. What truly does that mean? Does that truly mean availability of health care, or does that mean active seeking of those who need health care to enter the system? And so I think we need to have those kinds of conversations.
Because I brought up access to care, let me address something, and then Sarah Jo can add additional information. Senator Douglas, let me clarify. I was speaking directly regarding Eastern Kentucky, although access to care does come up in most, if not all, local health departments and a key health priority. But for Eastern Kentucky, I can speak as the local health director for Pike County that when I reference access to care, and Senator Wheeler, I feel quite positive will agree with me, and we do not have public transportation in Pike County. So Pike County is 786 square miles. It's the largest geographic county in Kentucky, but we have other very large rural counties in Kentucky without public transportation. So if you're looking at even a middle income family and the travel for a farmer's market or travel to just basic health care, routine visits, that access to care is more of a challenge than it would be from someone with a higher economic status as far as gas. So when I referenced access to care, you're correct in that that's a very broad topic. There's a variety of, it's a complex topic with a variety of reasons that access to care would be a challenge. Specifically in Eastern Kentucky, when I referenced access to care there, it's really more about public transportation and a lower socioeconomic population with the inability to access the wonderful resources that are available. And Pike County reflects many of the other rural, larger counties in Kentucky. Sarah Jo?
I'm in Central Kentucky. I have Nelson County and Hardin County, which I think people think, there should be a lot of access there. For us, transportation is in our community health assessment. That is a barrier, a healthcare barrier that we see. regularly, routinely. So I agree. Transportation, it can be providers. It can also just be which providers take what insurance, which providers, take Medicaid, which or if they have a cap on that, if they only take about 20% of their patients on Medicaid, and in what availability you have there. So it can be that. It can also be, I think about kids in school. We've had some mental health providers pull out of some of our local school systems that would provide that. And so when we talk about mental health, that's obviously reduced access to care because you're choosing between school and going to a mental health appointment. And then you have to have transportation, your parents do, or time off from work to be able to do that. So yes, you're right. Access to care is a multifaceted big thing. It's just not just a provider population ratio.
I think it's also awareness of the screenings out there available for prevention. We want people to take advantage of those. And as they said, the transportation is huge. We provide gas cards in Lawrence County for people that need transportation to cancer care because there's nothing in our county for that. We have a public health dental hygiene program that provides dental hygiene services in the schools because we have only a couple of dentists and neither of them take Medicaid. So we try to address those barriers through public health.
Yeah, Madam Chair.
Yes.
Thank you, Madam Chair. Yeah, there's no. I'm just pointing out some of the things because I'm a definition guy. I want to make sure that we're all having the same conversation, because often the reason we don't really come to good conclusions is because we're having different conversations, and especially in this space, as our co-chairs have talked a little bit about. We really do need to have similar conversation. Now, there's no doubt that there are some geographical differences in how we define access to care. It's important, and I think we as a task force will work very hard in that particular space. I also want to address one other aspect, if I could, Madam Chair. Mm-hmm. Okay. The other thing I wanted to talk about a little bit, or at least address or bring up, what is that we talk about public health, and we talk about healthcare outcomes as if they're the same. And they are not the same. Our public health is more personal. It is what people are doing for themselves. And when we start talking about healthcare outcomes, now we start involving our hospitals and our other providers. And I think it's really, really important. And it is especially important for those of us in the healthcare space to have our public understand that. And that is, and I'm being generous here, about 70% of the factors that affect our healthcare outcomes have nothing to do with our providers, our hospitals, mm-hmm. and those types of people. And I know that saddens some people, but I think that we truly need to understand that so that we can talk about the right subjects, but we can also have the right conversations within those subjects. Thank you, Madam Chair.
Thank you, Senator. And Representative Lockett, I know you have a question, and then we'll make time for our next speaker.
Sounds great. Thank you. A lot of my questions you've answered already, so we can skip those. I'm just curious in terms of when you send out a survey or when you make that survey available to the public, do you have any way of tracking like the percentage of population that responds to that?
Yes. So I asked to take this one because Representative Mosier mentioned Academy of Science and the usage of that. A employee of mine was the one that got that off the ground for Kentucky. And so the health departments come together and they use expertise from across Kentucky with our schools of public health, as well as our healthcare professionals, as well as epidemiologists within the health departments. And they do standardized surveys. The reason why we do that is because something as simple as asking an age range question differently makes our data not comparable. If I did 1 to 5 and you did 1 to 6, we can't compare our data. So what we've done in the Academy of Science realm is we've standardized surveys so that health departments have access to those and we can all be using the same survey information so we can compare data across Kentucky. We can look at different jurisdictions. We can look at it as a whole. But our community health assessment survey is one of the first things that the Academy of Science focused on, and they did that because of the new legislation, because they knew health departments were now required to do that community health assessment every 5 years.
So when you, like, are you seeing like a 20% return, like 20% of the population responds? Is it 50%, 70%? What would you say would be the respondents?
I would say you're doing good for 30.
Yeah.
About 30%.
I think we got about 500 responses in our.
Yeah.
Okay.
It's a range. Thank you.
Yeah.
One of the and one of the things too, I think, just not today, but in terms of kind of a long-term discussion and examination as well, then maybe you can help us with data-wise, would be outcome of and maybe this would come from the health assessment, but outcomes in terms of socioeconomic status, the health of, if you are a lower status, what's your health outcome versus someone that's not. What feeds into that? What's the reason for that? Those types of things. So we would love to see that data.
Absolutely.
Thank you.
In fact, as we wrap up, we would like to invite you back or someone alongside you perhaps to talk about you've established improvement plans and what results are you seeing? And are there other constituencies within the counties that are a barrier to success? Like, are there ways that we can help to remove some of those barriers? What came to mind is we have public libraries, and are those places that would be willing to offer some privacy for video visits, so that if you've scheduled an appointment with your doctor and you're going to do that by video, that maybe are you working with libraries, or what are some of those barriers that can be recognized, acknowledged, and then shared publicly as well, so that we can kind of come back to, you've done the assessment, you have an improvement plan, but what are the results? And what have we learned, what's working, what's not working? That would be great. Thank you so much for being here.
Thank you.
And I would like to invite next Sally O'Boyle, the Kentucky Food Industry Club.
Chairman, may I, while they're coming up? So I was glancing at Louisville's survey and then their plan. So they mention their 4 goals going forward: the healthy neighborhoods, ensure equitable housing, achieve environmental equity, and create healthy schools. So then I dug a little bit, and it's the healthy schools is achieving equitable outcomes in education by assuring every JCPS student has access to health services connected to social and economic support. So I'm encouraged that this is happening, but I think I really like our approach, what we're talking about, the food aspect of it and some of the other fundamentals of it, and not, again, directing to the healthcare industry. So these are exciting, and I'm excited that we're going to get some more facts about it, and that they're involved. This was actually 2020 was their first assessment, and this is their Healthy Louisville 2025 plan. So I don't know if we're going to see what we'll see implemented here, and so I'll keep an eye on that, knowing it's here now. I did not know this was here. So this is exciting, but also I think encouraging that we keep our goal in mind, the food, like you mentioned, because that's not apparently on their radars. So anyway, thanks for that, Liberty.
Do have a health services committee and other committees that are dedicated around that. So we need to keep ours as Make America Healthy very narrowed around perhaps food and providers and such. Well, thank you. Speaking of, Sally O'Brien, if you would introduce yourself, please.
Sure. Hi. I'm really excited to be here and that this task force is here. Good morning. Thank you for the opportunity to speak. My name is Sally O'Boyle. I'm 69 years old. I take no meds, and my PCP is at the local health department. I'm one of 4 Weston A. Price Foundation chapter leaders. We teach the value of clean food. I'm the founding and managing member of the Kentucky Food Independence Club. I deliver raw milk and dairy along with pastured meats and eggs to several drop points across central Kentucky. Clean food is my passion, and I love that it's a hot topic now. I'm here today to ask this task force to bring two urgent public health issues into focus. They're not directly food related, but they do impact our food and our farmers. Those two health issues are electromagnetic radiation exposure, especially from smart meters, and geoengineering, commonly referred to as chemtrails. First, excuse me, smart meters and the wireless infrastructure surrounding them, including 5G towers, are exposing Kentuckians to chronic levels of radio frequency radiation. This is not a speculative risk. Thousands of peer-reviewed studies point to biological effects such as sleep disruption, hormonal imbalance, oxidative stress, DNA damage, and even increased cancer risk. The American Academy of Pediatrics and independent scientists have warned about long-term exposure, particularly for children. What's more alarming is that many of Kentucky's electric co-ops, including mine, do not offer a true opt-out for the smart meter. Wired analog meters, the safest and most time-tested option, are being phased out, and there is talk of eliminating them altogether. This cannot be allowed to happen. People should have the right to protect their homes and families from continuous radiation-emitting devices, and a smart meter is continuous and it pulses. The data on the dangers of smart meters is overwhelming, yet the public is not being adequately informed or given a choice. Second, geoengineering, also known as solar radiation management, is no longer just a theory. Government agencies and private institutions have acknowledged experimentation with atmospheric aerosol injections under the banner of climate intervention. Across Kentucky, citizens have reported unusual sky patterns and residue, raising valid questions. What is being sprayed? Who is authorizing this? And what are the long-term health effects of exposure to airborne particles such as aluminum, barium, and strontium, which are three of the chemicals that are in the spraying? I had a hair test a few years ago, and my barium and strontium, everything else was like this. Barium and strontium were off the charts, and I don't take it. These are environmental health threats with growing scientific backing and public concern. I would appreciate if the task force could take a look at these and demand transparency, accountability, and informed consent on both fronts, the smart meters and the spraying. I would be happy to provide scientific studies, documentation, and expert testimony on these issues. Thank you for your time and your commitment to ensuring the return to health in Kentucky.
Sally, thank you so much for your testimony. In fact, the sources of information would be very helpful. We do have a task force that is working on some of these issues, but the sources of information would be very helpful, and we work together as legislators so we can share those, but also look forward to perhaps inviting them, especially as you've described the impact on food that's being grown. What is the impact? And perhaps we've got some scientific studies that we can share.
You see fields of cows with 5G towers with all the things on them.
Right. And being from a farm community and a farm person myself, it's been one method for many decades now that have kept farming affordable. So farmers are actually losing money. So they've invited all kinds of 5G towers to be built on their properties and such. So it's been an additional source of income, but we haven't necessarily understood side effects and such.
Right, yes.
So helpful. Thanks for taking the time to be here. And if you would, one great way of following back up, we each have a legislative email address, and Deanne is the right-hand person for our committee that helps us assemble the information. If you can share an email with Deanne, then she'll be able to share it with our committee.
Absolutely, I will. Thank you.
Great. Thanks for being here. Was there any other questions? Okay, great. Thank you, Sally.
Thank you.
Okay, so as we prepare to adjourn the upcoming meetings, I apologize, but I do think I tried to text everybody ahead what the meetings are so you could mark your calendars. Thankfully, I'm going to celebrate Deanne Wink here for a second. This is my third legislative session, and she is Johnny on the spot. So when my co-chair and I put our heads together and said, all right, how, where, when, and what's the most efficient way to visit with our task force, forgive us. There are several 3 o'clock meetings, but we were able to get it approved quickly and on your calendars quickly. So I hope that that's helped you to budget your time well and wisely. If anyone needs confirmation on what those dates are, let us know. Any other thoughts or questions for the good of the cause? And forgive me, I don't remember when our next meeting is.
July 10th, 3 p.m.
July 10th, 3 p.m. Okay, great. Thank you. We are adjourned.